Welcome back, everyone, to OpenLine. We are talking with Dr. Lisa Piercey. She is the commissioner of the Tennessee Department of Health, talking about the vaccine rollout. She has just said 56,000, the first 56,000 doses will hopefully be here next Tuesday in Tennessee. They will go out to various hospitals and be distributed to those frontline healthcare workers initially. I have one other question before we start taking calls, Commissioner. Will we get proof of vaccination? Will there be some sort of card that people get? And I think people wonder, will that then get you into a certain business, or will that be required for certain things going forward?
So I'm glad you asked that, Ben, because that's something that a lot of people have heard that they're doing in other countries. And we don't intend to do anything like that here in the state. I also want to reinforce the fact that we have no appetite to mandate this vaccine. This is a personal choice, and people should educate themselves. And while we encourage it and we strongly believe it's safe and effective, it ultimately is a personal choice, and the government is not going to mandate that here in Tennessee. What we don't know is if there are any private employers or other organizations that will require it for their employees or patients or students or whatever. Not sure about that yet, but that's not something that we intend to pursue from a government standpoint. Now, what I referenced in other countries is in other countries, they are providing some type of national card, sort of a proof of vaccination that exempts you from the requirements or sort of allows you a free pass. That is not going to happen here in Tennessee. What we will give you is we will give you an immunization card, just like if you were to go get a flu shot or anything else. We will document that for you. And everybody who gets the first dose will get a reminder card. It's just like what you get at the dentist. It's just a little card with an appointment time on there or a date. And so you'll get that, but there is no kind of pass that anybody is going to get. I will take this opportunity to remind folks that getting that second dose is critically important. You will get a little bit of protection from the first dose, but you must complete the 2-dose series in order to have full protection. And the other tricky part is your second dose of vaccine has to be the same kind as the first dose. And so a lot of people may not be able to remember or even care what kind they get, but it's very important when you get the second dose to get the same as you did the first time. So that's what the cards that we will give will have, is just a reminder of when you need it and what kind you got the first time so you can get the second dose.
What percentage of people do you think will take it? And what is needed? What if 60% take it and 40% choose not to? Where does that leave us with the coronavirus?
Yeah, so that's a great question. Let me answer the second question first, which is what is sort of the needed level of herd immunity in order to sort of move this behind us. Now, I will remind you, you can get immunity two ways. You can get it by having the infection, and so that's called natural immunity, or you can get acquired immunity through immunization. They're both equally effective, and they both work. There have been estimates that there needs to be about 70% of the population that is immune before we sort of back off of this pandemic. Nobody knows for sure if that is entirely accurate because we've never dealt with this before. There are some disease processes that go away once you reach 40%. There are others that require even higher, 80+%. But we're targeting around the 70% mark. Now, the first question you asked me was, how many people do we think are going to get it? And right now, all we have is sort of like polling data. And, you can think about an election or other political polling. It sometimes gives you a general idea of trends, but you can't really hang your hat on it for a lot of different reasons. The latest numbers that I've seen are closer to 55 to 60% of people who, when asked if you were offered a vaccine, will you take it? That is up from 40-something% just a couple of weeks ago. So we believe that as the time goes on and more people get it, particularly people who are friends or family and say, yeah, I got it and I'm okay, then that uptake will be higher. But right now we're looking at about maybe 60% of people who are offered it will get it.
But you hope 70 eventually. Okay, let's go to the phones. Let's go to Rich. Hello, Rich.
How you doing? Thank you for having me.
Yes, sir. Go right ahead. What's on your mind?
Well, my question is, I'm going to be 82 years old. When my time comes up to get my vaccine, if I don't want to get the Pfizer vaccine, do I have a choice of which vaccine I can get?
You would prefer the Moderna?
Yes.
Wow. Okay. All right. So let's say somebody, okay, well, you heard the question. What about that?
Yeah, so I believe you can get whatever you want as long as the provider that you're going to has it. I will tell you that most of at least of what we know right now, most of the vaccine that's going to be out in the community will likely be the Moderna vaccine because it doesn't require that really ultra cold storage like Pfizer does. So we can give Pfizer vaccine out in the community, but it has it has to be kept at minus 94 degrees Fahrenheit. That's dry ice type temperature. And so not a lot of places have freezer capacity at that temperature. And so most of what you'll see in the community, at least for the foreseeable future, is Moderna anyway. But that's absolutely something that your provider can tell you what kind of supply he or she has.
But you may not want to walk up and expect to be able to say, well, I think I'm going to choose this one or this one. Just, you're probably going to get the Moderna. If that is that right? Probably the Moderna. All right, let's go to Nicole. Well, I'm sorry if you need. Let's go to Nicole. Go ahead, Nicole.
No, you're fine.
Yes, my question, thanks for taking my call also, but my question is about positive COVID tests. If you receive a positive test, what enforcement is being done to ensure that the quarantine is taking place and that even though we're wearing our masks, that we are safe from positive, knowing that they're positive patients being out there? Okay,
thank you for that, Nicole.
That's a great question, and there are lots of different ways we can encourage people and educate people about the need to isolate and the need to stay at home after receiving a positive test. The fact of the matter is we don't have policemen sitting outside of the homes of everybody who's positive to make sure they stay at home. By and large, people are very compliant. They understand not only the impact to their own health, but to the health of others when they do that. But the short answer to your question is we can take action if we know somebody is willfully going out and intentionally spreading it to others. There are some provisions in the law that allow us to take action. We have not exercised that to date because most people have been very compliant. But essentially, when we have 3,000 and 4,000 plus new cases every day, it's just not something that we can enforce on an individual basis.
Nicole, thank you for that question. Let's go to Donna. Hello, Donna.
Yes, thank you for taking my call. She already answered the one that was on the mandate, but the other question I have is, since the vaccinations, you're giving the same vaccination to everybody, however, if you have the COVID itself, it attacks different organisms in your body. So some will end up on dialysis, some are having heart problems. I mean, how are you getting a vaccine that's going to cover an array of the stuff that everybody's getting? Everything's different for every patient almost.
Okay. All right. Thank you for that, Donna.
Yeah, that's a great question. That's actually a pretty interesting thought, Donna. So thank you for that. It probably would help to explain how vaccines work, or at least how this one is going to work in general, because you're exactly right. It does affect people in different ways. We have heard people with lung problems, but plenty of people with heart problems and even bleeding disorders because of it. what this vaccine does, and please forgive me for sort of oversimplifying this, but it essentially hooks together proteins, and when those proteins are put into your body, it sort of acts like a recipe, and your body recognizes it and said, oh, I know what to do with that. When I see this sequence of proteins, my body knows to make certain types of antibodies, and actually other types of proteins called spike proteins, which help us fight off infection. So it doesn't matter where in the body that the infection might tend to impact in a particular individual, because that response is your entire body, your entire immune system, and it doesn't matter where the virus comes into contact, it's going to be there in your bloodstream for that protection. Great question, interesting thought.
Let's go to Anne. Hello, Anne.
Yes, good evening. Is this program that the shipment for next Wednesday on the 15th, the program that Dr. Hildreth is associated with, and will you be continuing after the 20th of January, or will we be dealing with Dr. Hildreth and his group after that time when it comes to the Moderna or Pfizer and the vaccines? Because he was on this today on CNN and MSNBC, and some of his information is slightly different than the information I'm getting from you. And we have formed a strong bond with Dr. Hildreth weekly and throughout the last 9 months. So there are two different sources of information here. So could you give me some clarity on that?
Okay.
Sure, happy to. Dr. Hildreth is a fabulous partner. He and Dr. Jahangir in Nashville have been enormous leaders in the healthcare community during this entire response. And many of the successes that have been realized here in Nashville and in Middle Tennessee are due to the work of those two gentlemen. And specifically, Dr. Hildreth has been crucially important to helping us engage the minority community and overcoming barriers. What were initially to testing, we've been engaged with him and Meharry Medical College, as well as many other partners through our Office of Health Disparities, the Office of Minority Health and Disparities Elimination, in order to engage all communities to make sure, like I said, at first they had access to testing, and now they have access and good information about vaccines. So related to kind of how this will play out over the next several weeks or months, I don't think there's any date on the calendar other than just the pandemic ending that will cause us to decrease our partnership or our reliance on Dr. Hildreth and his team. They're doing a fabulous job, and we want to keep it up with them.
And she's asking about disparities. There could be some disparities, I guess. And is he more Nashville and you're statewide? Or if there are disparities, how might that be explained?
Sure. Well, if you're talking about discrepancies in information, it's probably just due to the fact that information changes on a daily basis with our numbers and with our dates. We're getting information directly from HHS. Not sure where he's getting his information, but I'm sure it's from a reputable source. I've never heard him say anything off color or that wasn't accurate. There's just a lot of different sources of information. But Dr. Hildreth, as well as Dr. Jahangir and that group are kind of focused on Nashville Metro, and I represent the state as a whole, but we work very closely with our Metro partners, and I look forward to continue doing that. They've been excellent to work with.
All right, we are going to take a break. A bunch more calls. We'll continue taking calls. Take a break. Be back right after this.